And National Party leader Judith Collins joins me as she does every fortnight. Hello, Judith.
Oh, hello, Chris.
Nice to see you. Thanks for your time. Yesterday, Andrew Little announced yet another 10-year plan for mental health and another monitoring body when it comes to mental health in this country. Do we actually need another monitoring body, or do we have something called the government or the Ministry of Health?
It's like next thing they're going to announce that there'll be a 20-member board that will actually direct what goes on in the government, and that would be normally called a cabinet. So it is really clear is that the government promised big on mental health, and all they're doing is having another working group, another report, no new beds, no new help for families who don't know how to deal with someone with mental health issues. It's a very much a disappointment. And our spokesperson, Matt Ducey, on mental health, he was just saying to me yesterday, it's just another report. It's just another shifting deck chairs. Why don't they just get the beds in place?
Well, there is millions and millions of dollars going towards mental health, particularly in Christchurch. And to be fair, the government has trumpeted up its work with Manaaki, I think it is, for children in schools, which appears to be quite good. But other than that, there's got to be something else. And I wish, if this monitoring board does exist, shouldn't actually monitor the funds, because there's a lot of money going somewhere, but I'm not quite sure where.
I think one of the problems we're hearing as MPs is from families who say that they've got a teenager going through tough times, or they've got a partner who's going through hard times, or even grandparents who are not coping. And this whole COVID situation just seems to make everything worse as well. And the anxiety gets so bad, and yet they really can't get much help, or else they have to wait things like 2 months to get an appointment. Well, sometimes that could be too late. We have suicide statistics that are just unbelievably appalling, around twice our road toll. And that doesn't, of course, count the suicide attempts. This is a major crisis. And I always feel that the government promised really big in 2019, $1.9 billion going into mental health. I thought, great move. Wish we'd done more, actually. And the government has now sort of attacked me for saying that, because apparently I shouldn't have said, well, I thought we could have done a bit better. Fact is, we should have done a bit better, but they just haven't delivered, Chris. And I don't think they've got the workforce. They don't have the standards. They don't have the expectation. They certainly don't have the beds in the crisis parts in the hospital.
That's particularly true here in Christchurch, at least anyway. Speaking of Christchurch, COVID-19 reported cases in Christchurch in the South Island have not been recorded. My understanding is now over a year. Many people in Christchurch are getting pretty frustrated having to wear masks. I know Aucklanders can laugh at that, but when there's no COVID-19 reported cases in the South Island and everybody is wearing masks, people are telling me on the street now they feel like the government is implementing a fear strategy for vaccinations. What's your take on that?
Well, I think the government prefers people to be fearful, and that's pretty clear. Because if they weren't, and I'll give you some context to that and why I say that, that's a pretty big statement for me to say, is because we don't get the information. So it's not just that they don't share it with the opposition parties, they don't share it with the public, they don't share it with the media, on which they base their decisions about level 2 in the South Island. It is hard to justify level 2 in the South Island. It is extraordinarily hard when you've had no COVID in the South Island for almost a year. I mean, how many years does this have to go on? And we have this dobbing in, this whole attitude going on. Some parts of South Island, walk around, everyone's got masks on. Other parts of South Island, almost nobody has. The thing is, too, people are starting to lose patience, because that patience is because they don't get everything that they're supposed to get. So I'm just saying to the Prime Minister and the government, be truthful to New Zealanders. Let us have the information. And we understand that sometimes that information is going to change as circumstances change.
I mean, how do you tell somebody living in, say, the likes of Reefton, Bluff, Westport, that they must wear a mask because there's a danger of COVID-19?
It's pretty hard, isn't it? It's a bit like Chicken Little and the sky is falling. Yes, we know if you're in areas like Auckland, even in Wellington, that it is very important to take every step you can to protect yourself. And Reefton people deserve to be protected too. The issue is that people are going to start, or the government is starting to lose the social license. My family's lockdown in Auckland has been now for 5 weeks, and now in level 3 is level 4. Pretty clear, they're saying to me, people are just all over the beaches on a fine day now. They've seen other people do it. They see, well, this is just nuts. And that's the way they're starting to react. And that is actually quite serious when you've still got cases in the community of COVID-19 and the government isn't quite always sure where it's come from.
What's your take on mandatory vaccinations for workers in any line of industry or sector in this country? You've asked the Ministry of Health for some guidance on that. Do you believe that all workers in New Zealand should be vaccinated, or what is your take on that?
Well, I am double vaccinated myself. My advice to people is to get vaccinated. And I've discussed it with Dr. Shane Reedy, with virologists, with everybody that I can, epidemiologists, people like Professor Des Gorman, who many people have seen, very highly qualified and skilled people. They say get vaccinated. But I've also said that we want to be careful about mandating or requiring people to be vaccinated, or else they lose their jobs. Clearly around the ports, around the border-facing people where COVID is most likely to come in, MIQ facilities, clearly they need to be vaccinated because otherwise they are a vector, and more of a vector than a vaccinated person for COVID getting into the community. And then we all end up with a lockdown. But when you're talking about mandating people who are just going to work and who have no particular reason that they would be any more subject to COVID than anyone else, this is a big step. And it is not something that I would generally agree with. And I've made it pretty clear. That is probably for most people a step too far. And the reason I say that, Chris, is that even though if we are double vaccinated, research shows we're about 83% likely to not get COVID when we're exposed to it. That's it's a big number, but we can get COVID. We can also transmit it as a vaccinated person. But the trouble is we probably won't have any symptoms. So we won't end up knowing we've got it. And we also won't end up, thankfully, in an ICU unit or in hospital, most likely. So actually, are we in danger of the person who isn't vaccinated? Probably more likely the person who isn't vaccinated are actually in danger of COVID, and that is the big issue. So if we can help people to not get COVID, that's a great thing. But I don't like this idea of two classes of citizenship. I very much agree that we don't have this for any other virus. Measles, which is far more contagious than COVID, for anything else, tuberculosis, anything. And yet here we are, the government and some governments around the world saying that if you don't get immunised, you can't have a job. That is, I think, a step far too far.
What about incentives? In the media yesterday or 2 days ago now, it was reported that we should be vaccinating people at the KFC drive-through. Do we have to always appease the lowest common denominator in this country?
Unfortunately, yes. So if we are looking at where this virus has started to take hold, it seems to have a certain vector around some of the gangs in particular. And, I, like you, won't be hanging out with the gangs anytime soon, but we do need to understand that they can be a massive vector because they're generally non-complying anyway. Do I think that it is good as well, and particularly for people who are worried about vaccinations, to encourage them to get vaccinated? The cost of a $20 or $25 KFC meal is considerably cheaper than, say, us all being locked down. So okay. I'm just a pragmatic person. Principally, no, I don't agree. On the pragmatism side, just get it done.
All right, I'll let you have that. Wellington Media packed a spectacular sad yesterday when you declined interviews on RNZ and I think News Hub Nation as well, saying that you need to appear because you need to talk to New Zealanders about what really matters. Ironically, it's the same journalists who are more concerned about the gossip that goes on with several of your staff members leaving. What's your take on that?
Over the National Party, we have a lot of staff. Obviously not as many as we used to have, but we have a lot of staff. And as you know, staff, it's pretty hard to, or let's say staff have loads of choices. We've got some staff who are leaving because they've been offered really great jobs and great opportunities. Well, good for them. And, we encourage them to take those, and we encourage them to come back when they are ready to. And that's what, the offers that we've got out there for people.
Oh, but your decision to decline an interview was being described as fatal.
Well, I don't know. Radio New Zealand wanted to talk about my interview that I normally have with them on a Wednesday morning, wanted to talk about staffing. And they had in the leader's office. Well, why? It's none of their business. Secondly, one of our staff members had been contacted by one of them from Radio New Zealand and asked all about why she was leaving. Well, she's leaving because she has another opportunity and she wants to come back again as well in a couple of years' time. I'm not going to have our staff being bullied like that. And I also think too, is that I'm here to talk about things like the Water Services Bill. I'm here to talk about the things that matter, like the three waters. The fact that the government is shoving through legislation and mandating and threatening to take all the assets of water assets off councils and put them in a big conglomerate. The poor thing. Happy to talk about that. What I'm not happy to talk about are staff members, because number one, it breaches their privacy. Number two, it's of no importance to anyone else.
Well, it did take 3 New Zealand Herald reporters to report on you not wearing a mask in Queenstown. That's a lot of resources to be doing that, isn't it?
Well, it certainly is. I thought Dr. Shane Reedy and myself were there with Joseph Mooney. I think I felt at times like we were some of the few people wearing masks at any stage, but we could have should have kept our masks on for an extra 1 or 2 minutes as we sat down. Look, okay, give that to those who were concerned, but I've also say is level 2 is very confusing in terms of their poorly drafted rules that aren't even on the one page on the website. You have to go to another one from there. I can see why people would look and say this is simply not clear, and we've given the government some ideas about how they can clarify them, but happy to cop that one. Should have had my mask on for an extra minute or two.
Has the New Zealand media, the mainstream media, have they got it in for you? Do you feel like you can't win?
I think that any leader of the National Party feels like that at times. We're certainly seeing at the moment, if you question the government, if you question Jacinda Ardern on COVID or response, then clearly we're the enemy on it. I don't think it's anything personal. I look at my predecessors, they all had a tough time when we were in opposition, and they certainly had a tough time up against a media that seems to be more focused in Wellington on, as you say, gossip, people's personal issues, whether or not someone's employed or not. How about they just focus on things that matter, as we are?
National Party leader Judith Collins, thanks so much for your time.
Thank you, Chris.